Today we're going to discuss how to make an improvised wound irrigation device. When you get a laceration and go to see your physician, generally they will use a syringe with sterile saline and some surgical soap to forcefully irrigate out the wound. You may not always have these things when you are on your own in a disaster situation. We can improvise with water clean enough to drink. That will be our irrigation solution, obviously, and a regular soft drink bottle, which will be the device with which we irrigate. I suggest that you use a soft drink bottle rather than a bottled water bottle, as soft drink bottles are generally thicker. They're designed to stand up to the pressure that carbonation can put inside a bottle. Generally, the plastic used for water bottles is a little flimsier. We need to make an orifice in the top of the cap. If you have a drill motor and a drill bit, you can certainly do that. Please be sure that you clean away any of the plastic shavings. Although they are inert, we generally don't want them in a wound. And in this case, I'm going to use an aim and flame and a piece of coat hanger. I'm going to put the coat hanger into the flame. Please note that I am putting it into the blue part of the flame. If you put the piece of metal into the orange part of the flame, it will quickly become carboned up, and when you puncture the top of the bottle, it will leave a nasty amount of carbon that is very difficult to clean off. I'm also not using any gloves as I am holding this. When my fingers start to tell me that the metal is getting fairly hot, it should be at the right temperature to quickly go through the cap. Doesn't generally take very long for that to occur. I'm going to put this down. And there we go. A nice hole made in the top. Now, we're going to go ahead and demonstrate how to irrigate a wound. You will hold it in one hand and use the other to open up the wound and irrigate into the wound as forcefully as you can. Obviously, you're going to need to stop and get some air back in there, and away you go again. If you have personal protective equipment such as gloves and or a face shield, now would be an optimum time to wear that. The water can splash because we are using quite a bit of force to push the water into the wound. We don't want to get blood and body fluids on us if we could all help it. Sometimes those things won't be available. Okay. Use copious amounts of water to irrigate the wound. Remember, the solution to pollution is dilution. I'm going to irrigate the bejeebers out of this wound. Probably use 3 or 4 of these bottles to forcefully irrigate the wound. The cleaner we can get it, the less of a chance we have of having an infection later on down the road. So there we have it, improvised wound irrigation device. Thanks for watching Midwest Disaster Medical Channel.